And a 7 News alert, the Centers for Disease Control warning hospitals nationwide about a growing number of superbugs, bacteria resistant to antibiotics. And 7 News reporter Russell Haythorne checking local hospitals to see how they're responding. And Russell, you found many of them already implementing strategies to keep the superbug out.
Yeah, and we checked with 6 area hospitals today, including Denver Health. All are taking a very aggressive approach in terms of keeping the superbug out. The superbug, virtually impossible to treat, and the CDC says it kills 1 in every 2 patients it infects. At a lab inside the University of Colorado Hospital,
it's certainly of concern, without question.
Dr. Michelle Barron explains she doesn't care for the term superbug, but she recognizes the danger of this now spreading deadly bacteria.
I think there's a level of awareness that we should be looking for things.
Lab techs here constantly review patient screenings to keep the bug out of the hospital. It's virtually resistant to all antibiotics, even the ones doctors use as a last-ditch option.
In these normally friendly, less resistant bacteria that we've taken for granted that we can always treat, now we're seeing some of these infections become untreatable.
Dr. Connie Price at Denver Health says her hospital is also proactively screening patients. If a patient appears to have the superbug, that person would be isolated.
Looking for these organisms on admission.
At Denver Health, they've had no instances of the bug. At university, only 2 in the past several years.
Antibiotic use is probably something that's contributed to a lot of the resistance that we see, and may be the end result of why we're seeing this now.
Doctors say antibiotics are being used way too often, allowing bacteria to morph into the untreatable kind. They say one thing you can do if you don't need antibiotics, don't use them.
Exposing your body to antibiotics on a frequent basis then sort of allows these bacteria to adapt.
We don't have to be the Titanic. There is time to reverse this.
So while these superbugs, or what are called CRE germs, are virtually impossible to treat once they enter your body, doctors say they're easy to keep out of your body. They can be killed on common surfaces by using disinfecting wipes and by washing your hands. Live at Denver Health, Russell Haythorne, 7 News.
Thanks, Russell. And doctors say these bugs can transfer their invincibility to other bacteria as well, like E. coli, making something like a common urinary tract infection a potentially deadly problem. Although the resistant bacteria pose a risk to anyone, people whose immune systems are weaker, such as the elderly and children, tend to be most susceptible.